I'm Kerry Bowers, and I approve this message.
The Tea Party Patriots National Organization has stated on their website that health care reform should include the following merits. First, it must be constitutional and protect the rights of all Americans. It must be comprehensible in that it is clear and simple for everyone to understand. It must be debt-free, that is, it should not add to the national debt. Healthcare reform must enhance relationships between doctors and patients. Reform should draw on the strengths of the free market and encourage innovation and competition. Reform must protect privacy and minimize the role of the federal government in health care. It must consider charity and incorporate opportunities for the private sector to provide charitable solutions. Integral to any reform must be an increase in choices for the consumer. And lastly, real healthcare reform must have increased transparency. I want to respectfully announce to the Tea Party leadership that they need look no further for a healthcare reform solution, because I have introduced one that achieves, and by a wide margin, every recommendation they have proposed as a requisite for real healthcare reform. And I have done so in a plan I call the American Medical Reform Plan. The AMR plan is constitutional, fitting well within the defense and general welfare clause of our nation's framing document. It is fully comprehensible in that it requires no interaction between the patient and government to execute. It not only does not add to the national debt, but it reduces federal funding to government health care programs by more than 90% once fully implemented. The plan, which focuses on increasing the supply of health care professionals, will provide for enhanced patient-doctor relationships through reduced patient demand. The AMR plan will use federal funding to train healthcare professionals, but their individual success will depend upon their own innovation and competition exercised in a free market environment. Privacy will be maximized because there will be no direct interaction between a patient and the government. With respect to charity, the AMR plan that produces essentially debt-free healthcare providers, combined with the fair tax that will restore the people's incomes formerly seized by the government, will create the greatest charitable opportunities to benefit those less capable of obtaining adequate health insurance. The choices of who, what, when, where, and how health care will be administered to you is completely restored to you, your doctor, and as required, your insurance provider, not the government. And lastly, because the interaction between the government and the patient is completely eliminated, there will be no transparency issues. I encourage you to learn more about the American Medical Reform Plan at www.kerrybowers.com and evaluate for yourself the possibilities the plan holds for you, your family, your community, and our nation.